Hi, everyone. Thanks for jumping on. My name's Chad. I'm from TrueLearn. Tonight, we're going to do a COMLEX Level 1 question breakdown webinar for you guys, co-hosted by TrueLearn and MedFlash Go. Before we get started, I do want to go over a couple of items just to help you participate in today's event. So by default, you're listening by your computer speakers if you logged on your computer. If you'd prefer to join over the phone, just select telephone in that audio pane and then dial in with the information that's displayed there. You'll have the opportunity to submit questions throughout today, so you can type those into the question pane on that control panel. We had a ton of questions submitted ahead of time that we want to try to address as many of these as we can. A lot of these will be addressed throughout the presentation, and then towards the end, we'll try to address some of those others that maybe you chat out to us throughout the presentation. So now I'd like to introduce our presenters. So from the MedFlash Go podcast team, we've got Taylor Brana, Sean D'Angelo, Royce Copeland, and Percy Tacky. So I'll let them sort of take it from here and introduce themselves.
Awesome. So I want to thank TrueLearn for having us. I'm Taylor. I'm one of the co-founders of MedFlash Go, and basically our team, we create podcast episodes and we do daily question of the day content. And we do a question of the day on an important topic for the USMLE, COMLEX, and all those things. And TrueLearn has been amazing and had us on today to discuss questions from ComBank. And we're super excited to be here. I'm a psychiatrist and about to finish residency. And we're also going to have Sean, Percy, and Royce with us. They're medical students. And as we're going to go through some of these questions with you guys, basically we'll introduce ourselves individually. But we're super excited to be here, and we hope that we can provide you guys some valuable tips, information, things that you might want to know as you're going through the process of studying. We all know that it's a really tough process. It can be isolating, anxiety-provoking, stressful, but this is the steps you need to take in order to become a physician. And this is, of course, your dream to get there. It's all of our dreams in this room right now to be great physicians. And so we hope we can help you guys get there.
Awesome. So at this time, I'm going to go ahead and share my screen here. And we prepared a few questions. And can you all see my screen now? Perfect. So you can see we're doing these in tutor mode. So it will allow us to kind of walk through these different questions, and the MedFlash Go team will be able to walk you through some of these. So I'll just let you guys take it from here.
All right, thanks, Chad. I'll get started. Hey everyone, my name's Sean. I am a fourth-year medical student. I am a co-host with Percy on our podcast, and hopefully we can get you to learn some tidbits about studying and excelling on these exams. So let's go right into it. First off, we have a 52-year-old male coming into the emergency department with difficulty breathing. It's getting worse over the past week, okay? Next sentence here, history reveals that he works as a warden at a state prison. Right there, highlight it, that's important. Over the past few weeks, he's lost weight, another important topic there that you can highlight. He has night sweats and a productive cough. That's something too, if you're a highlighter, highlight it, sweats and cough are important. Also seems to be blood in the sputum. That can participate here as a buzzword in the question. And then I go through questions straight through. I'm looking at the vitals here, 101, that's a fever. Other vitals, you know, unremarkable in my eyes. I'm looking at the temperature there. Chad, you can scroll down a little bit more. Sputum sample, organism of the cell wall, acid alcohol. Okay, I'm thinking TB here. This question just screams TB. It has the buzzwords for TB, but that's not what the question is asking. Medication therapy is initiated. Patient comes back because he drove through a traffic light. Traffic light, multicolors. This guy's having trouble with vision. I'm thinking optic neuritis. So what is the mechanism of the medication that's causing this vision problem? So it's asking for the mechanism of action, okay? You're landing on that last sentence. That's what they want you, that's what they're asking for, okay? So I go through this as deductive reasoning, all right? Activation of CAG, isoniazid, and this is pure memorization. There's some memory tools here that can help you, but first one, CAG, that's going to be isoniazid. pyrazinic acid, that's pyrazinamide. And then inhibition of DNA-dependent RNA polymerase is going to be rifampin. And then the last one, E, is probably going to have some people trip up, but that's going to be your aminoglycosides, think gentamicin, streptomycin. And that lands me on C. And in the back of my mind, I'm thinking, what is the treatment for TB? It's these four, it's the acronym RIPE, okay? Rifampin, isoniazid, pyrazinamide, and ethambutol. I didn't mention ethambutol yet. And with ethambutol, I know one of the side effects is this optic neuritis, where there's a color changes that can happen. And the way I look at this too is the word here, aripiprazole, oh, these words are crazy. Aripiprazole, the first two letters, AR, and then the last two letters, YL. I don't know why, but my mind always jumps to Argyle. And when I think of Argyle, I think of like multicolored socks. And I'm saying, boom, multicolored. That's my answer right there. So that's kind of how I process through this. Deductive reasoning, get out the ones that you know aren't the right answer, and just work your way through and get to that final answer there. And if you notice too, how I answer questions, I go straight through. That's how I go through my question blocks. I just go straight through. There's a question I didn't know, I spend too much time on in my head, check it, and then go back and then go all the way through. So it's just it's a one-way street. And I hope you got that, impression when I went through this question. Do you guys, any of the other teammates, do you guys have any input on this question?
Yeah, so one thing I want to mention that Sean did really well is, and when you're doing these questions, guys, and you're working through it, you want to try to figure out, first off, what's, in this case, we're looking for a diagnosis, and Sean right away, because of PRISM, bloody sputum, high fever, productive cough, his brain went to tuberculosis, right? If that bloody sputum might not have been there, maybe there was just a productive cough, maybe with the fever, the cough, you might think of pneumonia. But because of that bloody cough and that sputum, his brain went to tuberculosis. But this question is more difficult, right? Because this is asking for a mechanism of action of a medication. So it led us to say that, okay, there's a medication here. Now it's talking about optic neuritis. So the thing that we want to clue in on, and something that you guys might get asked on the Comlex, is what is the side effect of a specific medication? This is a third tier question, right? You have to figure out the diagnosis, you have to figure out the medication, you have to figure out the mechanism of action. This is a hard question. Now here it points out that 60% of people got it right. That's a tough question. And you have to memorize these very specific terms. So as Sean said, you need to know the mechanism of actions of all the tuberculosis drugs, and you're also going to need to remember the side effects of these medications. Now, the one thing I remember with ethambutol, Sean had a good kind of look with the Argyle socks. I remember ithambutol. That's the way I remember it. Whatever you guys have to do, here's a great table that TrueLearn provides of these different medications. You have to come up with a way of memorizing this or understanding it, because each of these medications, we're not going to go through them all, but each of these medications have specific side effects you're going to have to know for an exam. And it's important because you might have a patient that presents and has funny side effects, and you're going to have to use your reasoning to figure out what could be the possible effects here. So Sean, I think you did a great job, but I just wanted to point that out.
Yeah, great job, Sean.
Good job, Sean.
We ready for the next one, guys?
Yeah, you can move on. Yeah.
I think so. And then if you guys have questions on anything, please feel free to ask, and we'll get to them at the end. All right. So for this question, let's take a look here. So guys, again, my name is Taylor. I'm one of the co-founders of MedFlash Go. So I actually like to start questions looking at the actual question at the bottom first. So Sean likes to go all the way through. I'd actually like to go through the question and the answers here, right? So in this question, and again, on the real exam, you're not going to be able to cheat with the check mark there. So we're going to scratch that out. I'm going to assume that I'm not saying that. So which of the following medications is most likely responsible to the findings? So obviously for this question, It's not asking me for a diagnosis. It's going to ask me, there's probably going to be some side effect I'm looking for, and it's asking me what medication caused that side effect. That's already what my brain's thinking. I'm priming my head. I look at these meds here. Now, I happen to be a psychiatrist, so this question's perfect for me. But all these medications are essentially psychiatric medications. So now I'm clued in. This has to do something with psych medication and side effects. Now I go back up to the top. And a 34-year-old male with resistant depression, okay, presents to the emergency department with a headache and dizziness. So there's some side effects there. I might note that. He states that he was at an anniversary dinner with his wife, and when the symptoms developed, he states that he took multiple medications for his depression and was recently prescribed a new medication, as well as had a dose of another one increased. Okay, so I know he's taking meds. He was at a dinner party, and he's had a new medication started and another medication that was increased. I look at the vital signs, and it's pretty obvious here. This person is having a hypertensive crisis, urgency, blood pressure 190/110. That's super high. So I'm concerned about the blood pressure. But the fever, there's no fever here, right? All the other vital signs are normal. Now, in the psychiatric section, certain things we look for are serotonin syndrome and neuroleptic malignant syndrome. Usually those are associated with some fevers, especially serotonin syndrome. I'm not seeing that here, so that kind of rules that out for me. Do you guys see where my brain's going? So I'm trying to already think of the differential as I'm reading the question. That's super important. Ideally speaking, you want to try to predict the answer before you even see the answer choices. So I'm already ruling out any serotonin, SSRI kind of answers already out in my mind. So anyways, we'll move down to as we start to lower here. He's alert, oriented, deep tendon reflexes are 2+ and equal bilaterally. Now again, with serotonin syndrome or neuroleptic malignant syndrome, specifically for serotonin syndrome, you're going to see hyperreflexia. But these are normal tendon reflexes. So again, and they're not noticing there's some hypertonicity, inhaled rib lesions, okay, but I'm not noticing any sort of rigid movements. They're not talking about that. They're not talking about hyperreflexia. So that's, again, going to lead me to believe it's not going to be those answer choices. You'll see what I'm talking about as we scroll down here. So now I look at the medications. So what I know for this question is there's high blood pressure and this person started new meds. As you hear me talking on my thought process, I'm trying to get to the base. What is the base question here? The base question is new medication and high blood pressure. That's all I'm focusing on. So what the heck happened here? So fluoxetine is an SSRI. The one thing you guys have to remember is you're gonna have to memorize what these medications are and what class they're in. So fluoxetine is an SSRI, so that's out, okay? Imipramine, that's a tricyclic. Okay, and again, there's no rhyme or reason for this. You're just gonna have to memorize it, guys. I'm sorry, that it is what it is. Okay, I'm not getting any tricyclic sort of symptoms here. A tricyclic can often cause cholinergic or anticholinergic effects. I'm not seeing any like vision blurriness, urinary retention, drowsiness. I'm not seeing kind of those symptoms in there, so that's not really what I'm thinking of. Olanzapine is a second-generation antipsychotic. Remember, the first generations are more, you'll see that with like Haldol, Thorazine, those types of medications that will cause the extrapyramidal symptoms mostly. Olanzapine and other second-generation antipsychotics, you're going to think of more metabolic syndrome type symptoms. Olanzapine specifically starts with an O, so I often think of that as someone getting bigger for weight gain. This question has nothing to do with antipsychotics in this case. Phenelzine is a monoamine oxidase inhibitor. That is the correct answer, and I'll explain that in a second. Venlafaxine is an SNRI, so neuroepinephrine, and interestingly, venlafaxine or Effexor is the other name for it. Venlafaxine, if you have a lot of that medication, it can cause high blood pressure. But this question mentioned a dinner party. And what do we have sometimes at dinner parties? We have wine and cheese. So that was the one thing they might not make you think about. But if you guys remember in the back of your heads, cheese has a lot of tyramine. Tyramine, if you have a monoamine oxidase inhibitor, because tyramine is a monoamine, we can't break that down, and it actually has the effect of causing high blood pressure. Again, this is just something you're gonna have to memorize, you're gonna have to know. So with the monoamine oxidase inhibitor, now we're not able to break down that monoamine. We're going to have a surplus of it, and that's going to lead to high blood pressure. So that is the correct answer. Again, I know way too much about this stuff because this is my field of specialty. I don't expect you to know as much as I would, but you really do need to memorize mechanisms of actions and side effects of medications. You want to know what serotonin syndrome looks like. You want to know what neuroleptic malignant syndrome looks like. You want to know what the hypertensive urgency is going to look like with, or hypertensive crisis you're going to see with a monoamine oxidase inhibitor. You're going to want to know what first generation antipsychotics do, second generation antipsychotics. This is more a medication question. The one thing, and I talked to Sean, Percy, and Royce about this before, is when you're taking these questions, remember that it's not just about the question you're taking. You're going to want to think about how could this question have been rephrased. So that's, if you want to go the next level when you're studying, don't just study the question you're taking. Think about what questions could have come off of this question. And that's how you're going to really predict your next exam. And that's this question. So again, if you guys have any more questions about this one, just ask for the end.
All right, let's move on to question number 3 here and have a look.
Absolutely. Hi, everyone. Thanks for having me. My name is Royce Copeland. I'm a 4th-year medical student at Philadelphia College of Osteopathic Medicine. Currently work on the MedFlash Go team, help develop questions, and also help develop and facilitate our skilled application through Amazon Alexa. So kind of today, what I'm going to do is I'm going to kind of facilitate this question and kind of go through my thought process, how I would approach it, kind of through my own past experience. So right away, I want to look at the question, right? So what is the question asking? Which of the following autoantibodies is most likely detected? So now we're going to know which antibody is associated with the diagnosis that we're looking for. So we're looking at the question: a 42-year-old female presents to her primary care provider for complaints of worsening difficulty climbing stairs and rising from a position. So right away, I want to highlight the 42-year-old female and also difficulty climbing stairs and rising from a position. That symptom right there, difficulty climbing from stairs and rising from position, that's a very specific kind of scenario. And those things that you want to key into when you're taking COMLEX or any kind of board exam. She first noticed the weakness several months ago, so an acute kind of subacute condition. Beginning prior to the weakness, she had bilateral swelling and darkening upper eyelids. That's another very specific symptom that you want to key in on. So you want to highlight that as well. She has no specific or no significant medical surgical history. She does report occasional alcohol use. Physical exam demonstrates 3 out of 5 bilateral hip flexor and extensor, 4 out of 5 bilateral deltoids and net flexors. Her eyes and joints, her eyes are affected bilaterally. So you want to look at like the eyes in the picture, kind of give you a sense of what's going on. There are villicious papules on the dorsal surfaces of the metacarpal and the interphalangeal joints of the hand. So she's having some kind of rash on her hands. Laboratory findings find creatinine kinase 3000. So she's having a significant elevated marker, and this marker is specifically when muscle breaks down, it's released in the blood. So kind of looking at this picture, I'm like right away, I'm thinking muscle weakness, the breakdown of the muscle, which is the creatinine kinase, and the rashes. So some dermatological issue and myopathic issue. So right away, I think dermatomyositis. So which of these antibodies are associated with dermatomyositis? So we're going to look at the question answers. Anti-centromere, that's crust syndrome. The way I remember that is C in crust, and that's the easy way. Honestly, these are going to be antibodies. You're going to have to memorize them somehow, whether it be flashcards, talking to people, writing them out. That's kind of how I remember that. So I would say with no. And then going to B, anti-double-stranded DNA, that's going to be associated with lupus. That could be a possibility. That has, 42-year-old female, which is a clue for autoimmune, rheumatologic issues. She's having weakness, so it could be a possibility, but I think there's a better choice. We're looking always for the best possible answer. Anti-Jo, I know, is associated with inflammatory myopathic conditions like polymyositis and dermatomyositis. On a test to save time, since I already know and key in, kind of like what Taylor said, if you can predict before you get to the questions, you pretty much know the answer. And I would test that, I'd push that question or mark that question and move on. But just for sake of teaching, I'd move on. Anti-SCL70, that's a systematic scleroderma. So that would pertain to more diffuse fibrosis of the skin and kind of visceral issues, so I know is not the answer. Anti-smooth muscle is an antibody that's causing autoimmune hepatitis. This person does not have jaundice, upper quadrant pain, or any other symptoms, elevated liver markers, which that also could be another clinical vignette. So this is dermatomyositis. So we're kind of moving down. One of the things I'm almost guaranteed to have on the Comlex, they're gonna have autoimmune antibodies. You're just gonna have to memorize these, unfortunately. And whatever you wanna do, charts are great. That's what I did during boards, is make these charts. Comlex has great, or Combank has these great charts, and kind of just going over, you know, high yield stuff or flashcards, any of these things. And the best way to do this is just kind of just get it in your brain somehow. I don't know how you could do it, but just get it in there, because you're gonna get them. I got 3 or 4 questions on my Comlex level 1 pertaining to antibodies. Yeah, and one other last tip I have for you on this question is the bottom, TrueBank, the very bottom, it says, what is it? The bottom line right here. This is like gold right here. What I did is I had this and I literally copy and paste or typed out and had high yield review sheets. And this is like one of the greatest things I had, help me review before the exam or help me remember things if I had spare time. And like this question, it gets right down to the nitty gritty. Patients with inflammatory myopathies, which is dermatomyositis and polymyositis, presents with that symmetrical, the proximal muscle weakness and elevated creatinine kinase, which is exactly what we saw in the clinical vignette. You know the answer, mark it, move it. That's one good question you have. So.
One thing I want to mention that Royce did really well in this question, and again, for you guys who are studying for this exam, super important. You'll get to a point in your studying once you've reviewed it enough. All these associations are second nature, right? So when Royce saw anti-Joe, for example, he already knew it was polymyositis, dermatomyositis. When he had the diagnosis, he easily could answer this question in probably like 30 seconds. So even though we took the time in this question for him to answer it, in reality, if he was taking the test, this would have been one and done, because he has those associations down pat. When you take the actual exam, you have to have the associations down. And that's why it's a great tip that he was talking about, copy and pasting or taking notes on a quick sheet. So you have that quick review sheet. You really need to know these associations. You don't want to second guess yourself on test day. You want to have the confidence to know that it's one of 2 answers. You can feel strong about it. If you're not at that level, you might not be ready yet. And you really do want to have a sense of when you know those associations. But if you don't know your associations and you're about to take the test, I will tell you you're not ready yet. You really do need to know them, and you have to have them down, because the questions are going to be complicated. You might be nervous. And so you want to be confident going into test day. So I think it's a really great tip from Royce.
Yeah. Well, I also love Taylor, as mentioned before. If you know this question, like for me, I knew dermatomyositis going into this, right? But what if I never knew about anti-centromere? Like, you want to take your learning to the next level, I would actually study up on anti-centromere. Like, what is this? What is CREST syndrome? It's just as easy for Comlex to make a question about a 42-year-old female with some discoloring on the finger when she gets cold, some dilated blood vessels, show a picture, and that would be CREST syndrome. So it's just as easy for them to make other questions. The likelihood of having dermatomyositis is probably very low, but the likelihood of having something related with antibodies and associated to a diagnosis is very high. So.
Great advice, guys. We'll move on for the sake of time to our next question. Here we are, question number 4.
Hey, what's going on, everybody? My name is Percy Techi. I'm a second-year student here at the Philadelphia College of Osteopathic Medicine. So I'm kind of like the baby in the group, but you know, I've been learning and taking jewels from all these, you know, great men over here. So I'm gonna just go through this question and speak to you guys about how I go about answering this. And I'm kind of like, Taylor and Royce, where I like to look at the answer choices first before I actually answer the choices or like read the question. So first, I see over here that it's saying that there's a deficiency, right? Whatever the presentation is saying, the symptoms are occurring because of a deficiency of something, right? And so the answer choices here, you see niacin, riboflavin, thiamine, thyroid hormones, and vitamin B12. Something I want to take note of, or want you guys to take note of, is that with the boards, they like to use interchangeable words. You have to remember that niacin, riboflavin, thiamine are all vitamins, right? So niacin is vitamin B3, riboflavin is vitamin B2, and thiamine is vitamin B1. And so if you don't remember that, you can get tripped up sometimes, because if they had said, let's say, I don't know, vitamin 3 or 2 or 1, you may have thought you were answering the correct answer, but didn't, because you just confused the number. So just keep that in mind. Something else I'm looking at when I look at the answer choices is thyroid hormones is the only, I guess, answer choice here that's not a vitamin. So just keep that in mind. So, okay, I guess now we can go through the question. So a 58-year-old female presents to her primary care physician with the complaint of recurrent episodes of uncontrollable facial and chest flushing, diarrhea, and wheezing that have progressively worsened during the past 2 months. So for me, I'm probably over here going to highlight the facial and chest flushing, as well as the diarrhea, and even the fact that these symptoms worsened over the past 2 months. Just that time limit may be like a hint that may be useful going forward. Okay, she states that although the flushing and wheezing episodes are transient, lasting only for 10 to 15 minutes, they have become more frequent. In addition, she has missed many days of work due to persistent diarrhea occurring 4 to 5 times daily, which has not responded to loperamide. She had a complete hysterectomy 14 years ago due to fibroids, but denies other medical issues. She receives no medications. Physical examination reveals a middle-aged female in no distress. A 2 out of 6 hollow systolic murmur is heard over the left lower sternal border with regular rate. A complete blood count and basic metabolic panel are normal. A 24-hour urine analysis reveals elevated 5-HIAA. And for me, I'm going to highlight that, the elevated 5-HIAA, which is it's a breakdown product of serotonin. So right now I'm probably thinking, why would there be an elevated amount of this product? Probably because there's a lot of serotonin here, right? Okay, so this patient is at an increased risk for a photosensitive rash due to deficiency in what? And I would also I would highlight photosensitive rash. Okay, and so now I'm kind of, when I look at the answer choices again, I'm going to try to think about, well, if there's a deficiency in this vitamin or whatever this is, what would occur? And with answer choice A, niacin, I'm thinking about a deficiency in niacin. For me, what comes to mind is like pellagra, right? I'm thinking about dementia, dermatitis, diarrhea, and even death, right? The 4 Ds. And one way in which deficiency in niacin can occur is due to carcinoid syndrome, where there's this overproduction of like serotonin. And remember, back in the answer in the presentation, it says there's an elevated amount of 5-HIAA. So for right now, I'm already thinking, okay, this is carcinoid syndrome. And with this syndrome, there is going to be that sort of red rash, right? They said there's flushing here. There's going to be that diarrhea. So I'm pretty sure it's niacin. And then I want to go on to like the other answer choices and think about why they aren't the correct answers. And so for riboflavin, this is vitamin B2. These deficiencies are kind of rare. When they do happen, they may present with like cold sore, like sores and cracks in the mouth. And even, when you think of diarrhea, that's like a colon defect. Vitamin B2, it's absorbed inside the small intestine. So those are some of the things that help me personally. I just kind of rule that out. I guess later on, maybe somebody else can chime in for that answer choice. Now I go on to answer choice C, thiamine, vitamin B1 deficiency. This can cause symptoms like Wernicke syndrome, Korsakoff syndrome, as well as beriberi. So what we're thinking, encephalopathy with Wernicke, that can progress into something more serious like Korsakoff, which would be like memory loss, things of that nature. Beriberi, there would be cardiomegaly, cardiomyopathy. All of these things are not necessarily presentations that we see in this answer choice. So I want to go with that answer. Going on to answer choice D, thyroid hormones. You wouldn't see diarrhea with hypothyroidism. If anything, you'll actually see constipation. So for me, that rules that answer choice out. Also, you'll see a cool, pale skin. There'll be like cool, pale skin on you, and so that's not the flushing that we see in the case of carcinoid syndrome. And then going on to answer choice E, vitamin B12 deficiency, that can cause like pernicious anemia, and it can cause some findings like neurological findings and psychiatric findings as well. None of the symptoms that you see here. And again, going back to carcinoid syndrome and overproduction of serotonin, one of the precursors for serotonin is tryptophan, right? And so when you keep doing that, it's going to actually shift the production towards serotonin and cause a depleted amount of niacin. A depleted amount of tryptophan won't result in a deficiency in any of the other answer choices. And that's why for me, answer choice A would be the best and correct answer. I'm sure some of these other experts, maybe they have some other things that they can chime in on, but those are that is how I go about answering this question.
You did a great job, and the only thing I would just say with vitamin deficiencies, the boards loves to ask questions about deficiencies or excess. So you want to memorize when you have too much of something or too little of something. The big things is, again, just kind of like with other questions, unfortunately, you're going to have to remember what happens when you have too little niacin. You're going to have to remember what happens when you have too little thiamine, and you're going to need to know the presentations. When you first start studying, you're not going to know this stuff. That's why you have to study the questions. And just like Percy was going through each option, you got to know what the presentation for each one would be if that was the question they were asking, right? So if this question, we're talking about a person that was drinking a lot of alcohol and was saying words that were kind of nonsense, and it sounds like the confabulation, right? They're going on and on. They're talking about things that don't really make sense. Now we're thinking about thiamine deficiency. So for each of these questions or answer choices, you're going to want to learn how they would present. Again, that's just the process of doing lots of questions, going to your clinical rotations and all of that stuff. And that comes with experience, and it comes with doing lots of questions. I think one of the questions that some of you guys are going to ask is, how the heck do I learn all this stuff? And all of us are going to answer the same thing. It's either clinical rotations, reading, but most importantly, when it comes to the boards and COMLEX, you have to do a ridiculous amount of questions. And I'm not talking about a little amount. I'm talking about thousands and thousands of questions, and you're probably going to have to repeat them. And you're going to have to use the tip like what Royce said, typing out the key point from that question. Because at the end of the day, and Percy's still a little bit earlier on in this, but the only way, like if you see an M3 or an M4 or a resident and you're like, wow, these guys are so smart. The only reason they're smart is because they've practiced a lot and they've done a lot of questions. So all of us were not as smart and we couldn't do these questions. The only reason Percy knows this and Royce knows this and Sean and we're all learning this is because of the amounts of questions we're doing. So if you don't know this stuff as you're listening, it's not that you're dumb. It's not that you can't do this. It's literally just because of practice and consistent effort to do lots of questions, and that's going to get you far.
I'd like to add one more thing, just with the question stem here. And I totally echo what Taylor said. It's absolutely repetition. The big thing for me was note cards. I thought that was the best tool for me for just getting the repetition in. In the question stem, there was a sentence about complete hysterectomy 14 years ago due to fibroids. So here is kind of like an example of where they're trying to derail you, okay, from the question. They're saying, is this menopause? I heard like flushing, 58-year-old female. I'm thinking, maybe, is this menopause? And this is really the example where the test makers want to figure out how you can use clinical reasoning, okay? And it's also a way where if you want to go through the question from start to end and you want to highlight some things, it's important. It could help you, right? So after the first sentence, I'm thinking, okay, facial chest flushing, diarrhea. I'm thinking, all right, yeah, it could be carcinoid. It sounds like, it could be 58-year-old woman, menopause. There's all these options that are going through. And as you finish the question, you want to have different, symptoms and different, these buzzwords contribute to disease processes. So you want to highlight and say, okay, there's all of these, buzzwords for carcinoid, and then there's just one thing for menopause. So what am I going to go with here? I'm going to go with the carcinoid. And that's how you use clinical reasoning to get to the answer here, right? So there's all this evidence towards carcinoid, and there's only one thing against, and you can at that point say, all right, they're trying to derail me. It's carcinoid.
Great. Very helpful. So you guys, what do you think? We'll try to do one more here and then we'll get to some questions.
Sounds great.
Yeah,
All right.
yeah, I can roll through this one. All right, 30-year-old female presents to the ED with complaint of diplopia. Remember, that is just double vision when she looks downward. Keyword there is down, and she's descending stairs and having a problem with this. And this began after falling and hitting the back of her head earlier that day, acute, and she's having this problem. Doing some ocular motility testing, there's problems with, let's see, the right eye rotates slightly upward related to the left eye, okay? So she's having a problem looking down, okay? And it's giving her double vision. So the problem here is going to be the right eye, okay? So that's another way you gotta like go through this question as well. She's having a problem looking down. Her right eye is stuck up, so that's your problem eye. And then MRI reveals a lesion caudal to the left inferior colliculus, okay? Which of the following extraocular muscles is most likely paralyzed as the result of this trauma? Okay, this is really tough. It's really tricky. Neuro is really tough on these exams. But if you use some mnemonics, some memory tools, and you just work this out, draw it out too. This is a great question for diagramming. And if you have a diagram that's supplied in a question bank like this in TrueLearn, use the diagram, draw it out. That's always been a good way for me too. So answering this question, I'm thinking, okay, going through each one, I have a memory tool for this, and it's SO4 LR6, okay? And that's something you always want to remember. LR is lateral rectus, and that is 6, or the abducens nerve. And then you have the trochlear, which is SO4, okay? And that's superior oblique, okay? Now, those are unique because only those two muscles are with those two nerves respectively. And then the other eye muscles are going to be all supplied by the ocular motor, which is the cranial nerve 3, okay? So going through this question, that's the information that I have going into this. She's having trouble looking downward. Which muscle, you know, is involved that's paralyzed and cannot bring the eye down? It's tricky, but it's either the inferior, so you're thinking it's got to be the something that's on the back posterior midbrain, and this is left posterior midbrain going to the right eye. And it's very tricky, you have to memorize this, but there's only a few nerves that do this, and the trochlear nerve is one of those. And as I said before, trochlear is 4, SO4, superior or oblique is going to be what I'm thinking about with this, okay? And there, I didn't really have to do the deductive reasoning going through. I kind of went through the deductive reasoning in the question stem there. And remember, superior oblique is really weird. It's located midline near your nose, and it has a pulley involved. So it's located superiorly, but it actually helps bring your eye down and inward towards your nose, okay? So her problem was going downstairs, getting dizzy and double vision, looking down. She was having problems with the superior oblique because it wasn't allowing for her eye to look down and in. That's a really challenging, tough question. The neuro questions are going to be really tough on the exam. I highly recommend using a memory tool like that. Using a diagram here is very important as well. As I said before, there's that pulley system. This would be the left eye. So try and diagram this out. Make sense of it in your head. Use memory tools like that LR6, SO4, and then oculomotor, 3. And those are kind of the ways that I would go through this. But this is a toughie. This is a really tough question.
The other thing I would add with this question is, so in this question specifically, they're mentioning that the right eye is rotated slightly upward, correct? And so at this point, because you know it's like an up and down plane, you can immediately eliminate lateral rectus, right? So you can take lateral rectus out. So even if you don't know what the correct answer is and you're getting confused about if it's inferior or superior, you at least at this point have a 25% shot, okay? So the other thing too to remember on these exams is it's not just about getting correct answers correct because you know it, it's also getting closer to correct answers by ruling stuff out, and that'll be a little bit easier for you. And again, you just have to come up with ways of remembering, you know, how you're gonna remember this. The other thing too is it mentions that the right eye is rotated slightly upward. So in this case, again, you're thinking either it's going to be one of these inferior or superior muscles. Again, you just have to make sense of it. And then like Sean said, having a drawing, understanding what the muscles normally do, and then understanding what happens when the muscle is dysfunctional, what the eye will look like. So this question could have easily been written for the eye to be rotated or moved in a different direction. So try to answer this question as if the eye is going a different direction. You're going to have a different muscle group. So you want to try to, as you're doing this question, again, if you really want to take your studying to the next level, you're going to want to apply what would this question look like if the eye were rotated up or rotated down or rotated left or rotated right, and figure out what muscles are affected and what nerves are affected. Because this question could ask you what cranial nerve is affected. In this question, it could ask you, you know, what type of muscle action. Is it abduction, adduction? You know, there's multiple ways these questions can be asked. So you just want to make sure you're really thinking about it. The COMLEX is going to ask you about concepts, and you're going to have to figure things out on test day. So you have to understand the concept. This is the biggest error I think I see a lot of people do, is they study the question, they don't study the concept. And so if you study the question, you're going to get 10% there. If you study the concept, you're going to get 90% there. So just some tips for you guys.
Yeah, one thing I kind of want to add, kind of just the overall theme with like Percy and the vitamins, Sean with like cranial nerves, and my question with the autoimmune conditions, the antibodies. It's important to know the specifics, like the vitamins, like niacin, like riboflavin, thiamine. But it's also just as easy for them. If you just know that, that's great. But it's just as easy as them to put the answers: vitamin B1, vitamin B2, vitamin B3. If you don't know that, you know it's niacin, but you don't know what number, you're going to get it wrong. And it's same thing with the cranial nerves. It could be just as easy to put cranial nerve 6. Trust me, I've been there. I didn't realize they would do that, and I lost a lot of points, even though I knew the answer. So those are easy points. So kind of remember those things.
Great. Okay, guys. Well, we did have a fair amount of questions roll through as you guys were moving through these questions. So I'll just go ahead and start going down the list here. And I think a lot of the questions that were submitted ahead of time, you guys actually kind of answered along the way. A lot of them were just tell me about how you break down a question, those sort of things. Now, a good one here, and I think this is topical because one of the things we know about COMLEX is that recently the questions became fewer, but the questions got a little longer, right? And you all talked a little bit about pacing just then. So this question came in. Do you have a cutoff for moving on to the next question so you don't waste time? Do you have a point in your brain where you know, okay, I'm done spending time on this question, it's time to move on?
For the guys who've taken it recently, I mean, I can answer it, but I mean, does anyone have, for the ones who've taken COMLEX recently?
Yeah, I'd be happy to answer this. So I get through tests pretty quickly, and I have a very disciplined approach of going through a question block and you know, getting through it in a certain way and just start to finish. And I see this is a great question, because you can have a question that's very difficult, and then you can have a question that's very easy, and it could be a shorter question stem that's easier, and you blow through it and you move on to the next one. When you get to a tough one, it's longer, you read through it. I approach that as, I've gotten through this long question. If I don't have a good idea of what it is, if I'm thinking to myself right now, I have no idea what this question is, I have no idea what's going on here, I'm going to say, okay, Yeah, I think it might be this, but I'm gonna mark it and then I'm gonna move on and forget about it. And I'm going to keep moving forward with that marked question. I've made it to the end of the question block. I go back and then I do the same. I just sweep once again, and that's my last time going through that question. You've got to move on. You cannot linger on the past. You've got to keep going. You got to chop your way through the forest and get to the end. And you just got to stay. I really do think it's a discipline thing. And I think with the new blocks, it's really important to say, okay, I'm giving myself a minute and a half. Anything more than that, I cannot keep lingering on this question. I got to move forward and I got to keep momentum, because these tests are all about momentum. You got to crush it with momentum. You got to keep going through. You got to stick with your gut, and you got to keep trudging through.
100% agree. I read this, I kind of elevated my test taking. I've always heard that concept Sean says, but it never really triggered in my mind until I read this thing about the psychology of test taking. And it has to do, if you get stumped on a question, your mind starts to wander, and you start to get nervous, you doubt yourself. And it's actually, like Sean said, it's the momentum. Right? If you don't know it, you don't know it. Mark a question and keep moving on. Get all the questions that you know, go back. Then you can really sit on, all right, I've gotten 80% of the questions right. Now I'm looking at the other 20. Let's see if I can, get a couple questions right out of the ones I don't know. And then you'll do well. You don't want to get stuck on ones that get flustered, and it's going to mess up the easy question.
Yeah, and I know you all mentioned that's sort of where a lot of the benefit comes in doing a lot of practice questions, right? And we got a couple of questions about how many practice questions should I be doing. Do you all have thoughts on total number, or how many did you do? Just recommendations towards that?
So there's actually, I think there's someone did some research on this, and there's a direct correlation between the number of questions you've done and your test score. So the more questions you do, the better you will do on test day. In general, you want to probably complete your, everyone has different sets of Q banks. Obviously, we're mentioning TrueLearn and CommBank, because CommBank is awesome for COMLEX. And I truly mean that. We've all used CommBank. It's been wonderful for the test. You should 100% finish your Q bank completely. And a lot of people, what they do is they will eventually, before test day, they'll do hundreds of questions before, 100, 200 questions a day, and really just ram through them, make sure they can know the concepts and review. And so really you want to, I would recommend you want to get through at least 4,000, 5,000 questions. I know some people who've killed their exams, and when I mean kill, I mean they've done awesome on it and they've gotten really high scores. These people are getting closer to 10,000 questions. So that's, I would say, maybe a little excessive, but you do definitely want to do thousands of questions, probably get into 4,000, 5,000 questions. And absolutely you have to finish your Q bank and also review. So.
Yeah, I think that's great advice. And, we have such a high number of DO and COMLEX test takers that use our bank that we're able to dive into that data a little bit as well. So students using our COMLEX Level 1 bank or our USMLE Step 1 bank. And what we tend to see is there's this initial ramp up period where when students start taking questions, those first 500 to 700, there's a big increase in score. And that does tend to plateau a little bit after the 1,000 question mark, but we're still seeing about a 4% increase in score per 1,000 questions. So obviously when that correlates to a 3-digit score, that's a big deal for these students, right? And some of that actually segues into our next question here. And we got a lot of questions about this. And it is, how do I juggle preparing for the COMLEX and go through these COMLEX questions, and how do I break down these COMLEX style questions when I also intend to take the USMLE Step 1? And how's my focus different in breaking down these questions?
Again, I can answer, but any thoughts, guys?
Yeah, really great question. Really great question. And I think that recently, the COMLEX exam is separating from the USMLE. Okay, and they're kind of diverging paths here. There are the basics that we need to know as physicians, yes, and they're still in there. with COMLEX, to get a really great score on COMLEX, you've got to know your OMM. Okay, it's huge. So that's where, you know, the key question bank here is going to be TrueLearn to get those OMM questions in. Also, there's more, and I noticed this on level 2 a lot. It was definitely on level 1 with the, you know, questioning using laws. So all these different like law questions, and you know, which law is this, HIPAA, some, you know, emergency department law. And then in like level 2, there was a lot of, and level 1 also, a lot of these kind of like ethics, like kind of soft skill kind of questions that you're just not going to get on USMLE. You're not going to get those, not even as like a, you know, not even as those trial questions that they put on USMLE. Okay, they're not even going to be on there. They're going to be on levels. Okay, they are, and they're going to count too. So that's something that you really want to focus on for levels, is those kind of soft skill, ethics, you know, those types of questions. Royce, I know you had those questions on your test, so tell me about it.
As soon as I took the test, I think I texted Sean immediately and said, yeah, I think I got 30% like ethics, kind of OMN related. Yeah, unfortunately, I would study USMLE step and level, the medical knowledge, exactly the same. Just study, grind it out, know your medical knowledge, but tailoring for the COMLEX, 30% of the questions, or roughly, are gonna be ethic related, OMM related. So if you don't get those easy questions, the OMM specifically, it's gonna drop your score. And then the ethics questions, that's something you're gonna have to I just reviewed YouTube videos, kind of like different laws, and that's kind of stuff you have to like just kind of generally figure out on your own. I'm not sure if TrueLearn is offering more ethic questions, but that's what I've seen it's more tailored to.
Yeah, and I can answer that question. Absolutely. You know, we're constantly maintaining a dynamic bank. So as those ethics questions are increasing, our bank does the same. And a common question we got leading up to this was, tell us about some of the COMLEX changes. And I would just mention, we do have some blog spots on that some of you can go to and read up on those. Some of the big things we mentioned: fewer questions, longer stems. They've actually removed those multi-step questions. That's been about a year ago. And then obviously for the first years who are attending, you've got potentially the pass-fail moving forward in a couple of years, where your test will be not a 3-digit score, but a pass-fail score, right? So those are things to keep in mind as well. The next question we've got here are, how much time do you spend reviewing each question you do?
I'll actually take that question. I've done some tutoring as well for students that are taking the exam, and you want to spend easily your review time. So let's assume, for example, you did a 50 question block. Realistically, if you spent an hour, right? Let's say you did a minute, a little bit more plus per question. You want to easily spend 2 to 3 times the amount of time reviewing. Sometimes, and I'm talking about this early on, later in the game, when you're doing the questions later for review, it'll be quick. But for people, especially early on, and this is why, like, if you really want to know this stuff, you should study in advance and start doing some questions ASAP. If you really want to know the concept, like for example, the eye muscle question. If you forgot, or you're not as strong on the ocular muscles, you really do need to spend some time drawing out the picture, reviewing each muscle, imagining what the question is going to be for different sections. Easily in that one question, you could make 5 to 10 questions, right? If you can conceptually understand the possible questions they could ask, you've taken one question and you've really answered 10 questions. Do you see what I'm saying? So you will get more bang for your buck if you take that a little extra time to review the question, really know the concept. And when you really do actually know the concept, you don't really have to study that hard, because once you know the ocular muscles, you're gonna know when the eye's moving, you know, down and out, that it's this muscle versus a different muscle, right? You're gonna know which cranial nerve that's associated with. You're gonna know when that question comes up, you're gonna know how to figure it out. So that's why I do highly recommend to students, even though it is tedious, figuring out the concept, spending at least two times more time. So if you spend an hour on your questions, spend 2 hours reviewing, and that will decrease as you later go down and as you do more questions. But that's also why you want to set yourself up for success by doing questions early enough as part of your academic schedule, to start to do questions early. Because again, if you start to get to, like, if you're cramming questions 1 month or 2 months ahead and you didn't really understand the concepts, you're not going to have enough time. It's just not possible. So again, there's different approaches, and I'm sure everyone's going to have a different answer, but I would say at least twice as long.
Great. Yeah. And the next question I had on here was, someone asked, do you study all of the answer choices and spend time on all of them? And it sounds like absolutely yes, right? So the next question then would be, do you study other material or just study the content in the questions? I think you've kind of touched on that a little bit.
So again, I mean, I'll just make it quick. Use whatever materials you need to figure out the concept. So like, let's say you're doing the question, there's not a really good image, or you need to refer to other things, just use reputable resources, use your textbooks if you need to, right? But whatever resource you need to know the concept.
Okay, great. Someone asked, is there a lot of neuro on the exam?
Yeah, I kind of addressed that in the text. I think from what I remember, the NBME and the websites, they have the percentages broken down, but those are just estimations, to be honest. From my experience, it was like 10-ish or so % of the exam, but neuro was a harder portion of the exam, if that makes any sense. Like, there's different subjects, maybe psych, it's just like the associations, but I remember neurology, there's a little bit more critical thinking and concepts, so that was a little bit harder subject.
Yes. Another thing to add to on the neuro is different with USMLE and level. I think with level, it's more so similar to OMM questions. You're thinking like radiculopathies. Those radiculopathies are huge on COMLEX, whereas USMLE is more of I want to say like stroke, and more so like focal neuro deficits, and as well as like the that eye muscle question would be a very good USMLE. I mean, both tests, but that's more so of a USMLE style question.
And for those of you on the webinar here, under handouts over here, we've actually just uploaded a PDF. It's kind of a breakdown of some of the differences between the COMLEX Level 1, the USMLE Step 1. And I guess we've got time for maybe 1 or 2 more questions here. And this is a question I get a lot. And it's, how do you recommend taking these questions? Would you do it by body system, or do you test by just a variety of questions? What's your approach?
So I've heard 2 approaches, and again, Sean, Percy, Royce, you tell me if I'm wrong. The two approaches I've heard, and this is my preferred way if I were to teach someone or tutor someone, I would start by going system by system and making sure like the broad topic of a system. So let's say it was cardiology, like go through cardiology and go through the topics, and like, for example, review your first aid or review whatever videos you're using or whatever content you're using, and then do all of that system. And so I would actually argue it's better to go system by system first, finish the entire QBank by systems, and then when you get closer to test day, do random blocks, because the actual exam is random. So you want to start by making sure your system by system, figuring out where you're weak, where you're stronger, and then when you get closer to test day, do random blocks, because the actual exam is that. But again, people do it differently. That's just the way that I think is preferred.
Yeah, I've been taught the same thing. So obviously I'm in the process of, doing what you guys are doing right now. But I was told to pretty much go by the systems, and then on my first pass, and then once I'm done with all that, do a random timed. That way I have the bigger picture and, can look at the different differential diagnoses.
I think we were talking about this with you yesterday. Yeah, like going through like the systems, cardiology, neurology, and by doing the systems and getting the breakdown of what percentage of questions you get right, 50% versus 70%, what subjects you're weaker in. So
Right.
then and I can't emphasize enough, if you're doing well in a subject, you know it well. Like, obviously you want to do best, but like spend more time on stuff that you're weaker on, like statistics for me, and some of these other stuff that was a little difficult for you, whatever it may be. If you're weaker in it, focus on that, because that's where you can gain a lot more points.
Yeah.
Great. Well, guys, I think you've provided a ton of great advice today for everyone who logged on. So I just want to say special thanks to the MedFlash Go podcast team. We are at the hour mark. I really appreciate you guys jumping on, and all the attendees who jumped on. I think it was really helpful. A couple things for you all after we log off here. You will receive a survey. We'd love it if you can provide some feedback. Obviously, we're trying to do this, provide some value for you all, and we'd love to continue to receive that feedback and see what you find most helpful. And then also within a day or so, you'll receive a recording of this webinar. So if you'd like, you can go back and view that again. But again, I just want to say thanks to all of you for attending. Special thanks to the MedFlash Go podcast team. That was really helpful, guys.
Hey, thanks for having us. That was I think I can speak for us all. That was really fun, and we love teaching, and it was a pleasure.
All right. Well, everyone have a great night.
Good luck studying, guys.